Hey Tom,
Oh, hello. Good morning. Can you hear me well?
I can. Yeah.
Fantastic.
Morning.
Good morning. How are you this morning?
Doing well. How are you?
Yeah, well, thank you. Yeah, well, thank you. Very nice and sunny here.
Is it
Yeah. How is it on the West Coast?
dark at the moment?
Well,
Yesterday
yeah.
was yesterday was a bit rainy, which was actually
Oh,
kind of
right.
nice for a change.
Uh, has it
But
been quite warm then?
it's not too warm yet, but we just where I live, we don't get a lot of rain. It can be
Okay.
very dry and kind of
Mm,
deserty.
mm,
So
mm,
every once in a while we get a good rain day. It's kind of nice.
mm, mm. Bro.
All right.
Good to know.
I'm gonna just go ahead and make you both a co-host in case.
Sure. Oh, yeah, for the
Hey
quiz
there.
later
Hey,
on.
Bettina.
Hello. Good morning.
Yeah. So you should, I know, Bettina, you said you don't have anything to share on your screen. That's perfect. I'm going to go ahead and make you both a co-host in case you need any of those permissions, but
Okay, great.
should be set. Okay, I'll go ahead and
Mm.
add everybody in. Welcome, everyone. Okay. Welcome. Thanks for joining us. We'll just give just a couple minutes for everybody else to hop onto the call. Really appreciate all of you being with us today. Um, while we're waiting, maybe if you can type in the chat what you found most interesting in the course so far. I would love to hear your thoughts.
Doesn't quite relate to the course, Jessica, but we're moving out of where we're living at the moment. And so I
Mhm.
wanted to have a deep clean done of the house. And this morning I had a professional come round to inspect the house, to do a bit of an inspection. And she had her form, and I'd already done what I thought was a really good clean. And she was going around, have you thought about above the oven? Have you thought about the windows? And I realized all of these things that I just don't think of. And that made me think of the sanitary inspection and the professionals that we have in that domain.
I love that, Tom.
Mm. It's ingrained in my brain every thinking. I'm just thinking with
It
the
just
lens of
comes up.
sanitary inspection.
Hmm. Well, I'm sure her form helps and her experience helps. I love that.
I was a little disappointed that she picked up on so many things that I didn't think were not
Problems.
sanitary.
All
Catherine, are
right,
you
everyone.
suggesting with small people and animals, it's harder to keep things sanitary, or we have
Hmm.
different perspectives?
I'm just saying it would be nice to have some professional input.
Okay, I see. Oh, for them or for you?
Certainly both, all of them. Although
Okay.
my dogs don't have thumbs, so it would be harder.
Are they not? Well, that is interesting.
All right. Well, I appreciate everybody joining us on time today. And so we'll get started, and hopefully, anyone who hops on later will be able to catch up. So, yes, while we're getting started, if you want to type in the chat what you found most interesting in the course so far, I'd really love to hear everybody's perspective on that and kind of find out what you've been enjoying most or finding most interesting, or maybe what's been most surprising to you. Okay, just a few little reminders on the office hour sessions in case this is your first one. So obviously they're every Thursday at the same time. So that'll continue throughout the rest of the course as well. Um, your participation is not mandatory, but we highly encourage it. We think it's helpful and we love to hear from you during these calls. We think it helps everyone to learn more when you could be present and ask questions and share your perspective on what you're learning. The sessions are recorded and posted in the course. So if you've missed the last couple of sessions, you'll be able to find that in the course. And if you don't get to stay for this whole session, we'll post the recording either later today or tomorrow. And then, yeah, we're going to just ask that everybody will contribute during the meeting today. So there'll be a lot of opportunities to contribute. We can raise hands and answer questions, ask questions. We'll also have a few polls and quizzes and opportunities to engage in that way. We have a couple of answers in the chat that I want to talk. So most interesting thing are case studies. I think that's really great. The case studies are very cool. I think it's a great way to apply what we're learning specifically to a community and a context. I like that as well. And then someone else, Tom, you shared that it's perception of
قال
risk.
محمد.
That's cool. Okay, so where we are in the course. So this is the end of week 3. So we've just gone through Unit 2B on sanitary inspection programs. So hopefully everybody has gotten to at least start on that. If you haven't, it's going to stay available for the next 3 weeks as well. So you will be able to catch up. We'll just encourage you as much as possible to keep with this schedule so you don't get too overwhelmed trying to finish everything at the end. But so we're going to review most of Unit 2 today. So we'll have a little bit from 2A that we want to follow up on from last week. And then we'll jump into some review on 2B, looking at challenges with SI programs. I appreciate everybody putting in the chat what they've liked so far. So another vote for case studies. And the platform itself. That's great. And then Sally Ray says they like the question approach for explaining the concepts. That's great to hear. Our learning design team is wonderful, and they always think of great ways to incorporate what we're learning. I find it a very useful way to learn too. Feel free to keep sharing in the chat. We'd love to see it. Okay, so our first poll is just a check. I want to see everybody's opinion. So I'm going to launch a poll really quick to see your opinion on why you think we include discussions. So just your honest thoughts, why you think we include discussions in these courses. If there's another thought on your mind as why we might include them, feel free to put that in the chat as well. But just what are your thoughts? Okay. Lots of responses coming in. Thanks, everyone. Just want to know, yeah, your thoughts, your perspective. Okay. Everybody's answer in. Another 30 seconds. Why do you think we include discussions in the course? Okay. All right. So hopefully everybody can see all of our answers. Yeah, so a lot of great answers. And so these are all great reasons for why we include discussions in the course. So yes, we want to help you process and apply what you're learning. We get to do that when we think critically about something. Um, and we want to be able to learn from others' experiences. So I think we've said it on these calls before, but this is a global group in this course. We have learners from, I think, 30 or 40 different countries. And so we get to learn from those different contexts, and we're all in a different place um, where we are with our sanitary inspection programs or maybe with our water quality testing programs. And so that's just a wealth of knowledge that we get to learn from in the discussions. Um, and then, yes, we get to practice explaining our thinking and our decisions. And so that's one of the benefits too, is we get to explain it from our point of view or from our perspective that we get from the work experience that we have. And we get to kind of explain that here in this course before we maybe have to go explain it in the real world, because maybe we're advocating for SIs where we don't already use them. And we'll already have a little bit of practice explaining those kinds of concepts and topics when we go out into the world to share that. So I'll give a few minutes if anybody else wants to share a perspective on a discussion forum, or maybe um, which of these do you think you've experienced, or are you missing out on any of these things? Or if you're having any challenges with the discussion forums, feel free to speak up as well. We've seen a lot of great discussion in the forum so far, so that's very encouraging. So yes, I'm just going to encourage everyone to continue engaging there. Make sure when you are writing your posts, you're doing it from your own perspective. We really love it when we get to hear about your specific context, maybe what happens in your country or your region, what's happened in your work. Those examples are really great. And just a reminder that there's often no right or wrong answer for these discussion questions. So we're not grading what you're writing. We just want to see you engage. So hopefully that takes a little bit of pressure off if you have felt any pressure for the discussion forums. And then, yes, feel free to go through and read posts from others in your group and connect with them as well on what you're learning. Okay, so I want to see kind of a quick check on where some of us are. This will help us kind of gauge some of our discussion today. So you can use your reaction buttons and just say, have you gone through most of Unit 2B? Just kind of where are you in the course, or kind of how are you feeling about some of those items? Okay. Had some people go through most of 2B. Some people relate to a lot of the SI challenges. Some parts are confusing. Yes, that's true. If there's anything particularly confusing, we can discuss that on the call today. Just be prepared to ask the questions. We can help through that. I know we've had a couple votes for haven't started yet, and that's okay. Again, the material will be there when you're ready to start. So, okay, great. Thanks everyone for sharing. That's helpful to know. We're going to start by going back to a few um, of the concepts in 2A that we had a few questions on last week. We want to make sure we don't miss those, and then we'll move on to 2B. If at any time you have questions that you want answered on this call, feel free to raise your hand or to type your question in the chat. And that's really, again, that's what these calls are for. We definitely want to make sure we get to your questions and to the things that you want to discuss. We have a few things to guide the call, but we would rather answer questions. So please, again, raise your hand or type the question in the chat so we can get to it. Okay, another reaction. One of the questions on our call last week was about water. So we want to revisit that topic. Quick check if you have used water, if you've never used it, or maybe you've never heard of it. Kind of want to know where we are with water. So if you'll use your reaction button again. Okay, Wilson's used it. Mita's used it. Okay, wonderful. Sally Ray's used it. Oh, great. Okay. Lots of use. That's wonderful. Okay. And a couple votes for haven't used it yet. Okay, that's great. Well, we might have some people on the call today who are more experienced with water than I am. I have used it a little bit, but I'm going to go ahead and open it up and just show everybody the platform and specifically where you can find the SI forms in case you're interested in doing them on water. World Health Organization has gone in and added all the SI form questions so you can easily grab them from the indicators library. Okay. So this is the mwater homepage. So portal.mwater. This is made to collect lots of WASH data. That's how mwater got started. You might also hear the term Solstice. That is a similar platform that they've created to collect other health-related data. So maybe not specifically water, but other data that is similar. So if you see the term Solstice, it's a very similar platform. So if you're new to mwater, it's free to sign up, free to use. So you just go on there and sign up for the account. If you need help learning how to navigate the platform, they've got this manuals and tutorials link right here on the homepage. Again, I am not an expert, but they have very helpful videos on this page that will walk you through how to create a survey, how to use the survey to collect data, and then how to process that survey data. So these 3 videos you can watch if you're new to the platform to get set up. And then specifically for what we're looking for, you'll see they have this indicators tab at the top. You can click on that. Indicators are essentially global standards for data collection. So a lot of organizations have entered what we call indicators, and those are kind of the standardized questions and data that many organizations like the JMP or the World Health Organization are collecting in some of these areas. So you'll see that they're broken out by sustainable development goals. And if you scroll down, you can also see them broken out by a lot of different topics that we look at in the WASH field. So sanitary inspections are one of the indicators. So we can search for that. You'll see that they have the one for sanitation systems as well, but all the way at the bottom, you'll find the newest ones for drinking water. So if you click on that, you'll come to the indicator page. This is linked directly in the course as well in Unit 2A, but it's easy to find by searching. So they'll give you a lot of information about what these indicators are and how you can use them, a lot of what you're learning in the course about sanitary inspections. how some of the risk scores are calculated, and what's included. If you want to use these for a survey, you'll click Start New Survey. And what that will do is basically create a new survey in the platform for you, and you can edit it how you need to. So one thing to note is you'll see that all of the different sanitary inspections are included in the survey when you click that button. So you'll see kind of in this navigation on the right, the name of the survey. So here's a dug well with a hand pump, and then all the questions that are included on that sanitary inspection. And then you'll see the next one, dug well with a windlass. So if you're going to use this in the field or have your team use it in the field, you may need to come in and edit it to remove the sections you don't need. So you can use, like, if you don't need dug well with a hand pump, you just click here to remove that section. This doesn't edit the main form. This just edits the copy that has been created in your account. So you will need to go through and make the versions that you need for your team, um, so that they can use them in the field. And then once you've got the questions that you need for the equipment that you have in the project, um, you can hit deploy, and that's what will send it to your survey app. And so all the collection is done on the app side of MWater. Um, and you can do all the data collection there, and then it will load into MWater later. Are there any questions about how to do this sanitary inspection forms in MWater, or any comments from those who have maybe used it in the past? Has anyone used it specifically for sanitary inspections? Curious. I do believe they're fairly new, like the sanitary inspection forms for the water projects is a very new indicator. Well, if anybody starts using them and has questions or runs into challenges, you can reach out to us, or if you think of a question, um, feel free to put it in the chat during our call, and we can try to help you through that. Again, I've used MWater a little bit, so maybe not an expert, but I'd be happy to help you work through those challenges. Jamal, yes, it's a great application. It can be very helpful, kind of get away from paper forms sometimes, and to be able to do it just automatically online and be able to have all that data be compiled. Okay, so it looks like we may have at least one learner who couldn't join the call today who's used it for SIs. So um, that's it. Might have to ping him some questions if we get them. Well, great. Okay, so just know that that's a available form for the SI um, for you if you want to start using that. And yes, just gonna highlight that it's free and accessible. I think we had one comment last week that maybe you had to pay to be able to use these forms. So we just want to clarify that everybody should have access if you'll just sign up for that free account. Okay, and then one other topic that we've had some questions on for 2A is the in-between answers that we went through in the course. And so we've had a couple questions come up in the WhatsApp discussion as well as our Q&A form. So we just want to talk through this a little bit. So the first thing to note is the sanitary inspection forms have a yes and a no. So there's not an official in-between answer on the essay form, right? But there might be cases where we're unsure. And I know we did talk a little bit about that last week as well. So in those cases where maybe we are unsure, we would consider that maybe an in-between. And we would recommend that you check yes and explain in the comments the condition or maybe why you're unsure so that it can be followed up at a later point. So this is one of the examples from the course that has been highlighted as kind of an in-between for the apron specifically. And so what I find to be very helpful when we're looking at, is this a yes or a no or an in-between, is the text that pops up under the question, because that'll help guide us what a clear yes looks like. So it's saying, is it absent or in poor condition? And so the clarifiers for that are there any, maybe the apron is damaged? Does it have big gaps or deep cracks that would allow contaminants to directly enter the well? And so if we look at this apron, we don't really see any really big cracks, no big gaps, but we can start to see maybe some smaller cracks forming, and those might grow. We can also see that there's maybe some erosion starting on the side. And so these might not be letting contaminants enter right now, but they might become a problem soon. Yes, thank you, Tom. That's very helpful. I always forget that you can use that. So yes, Tom's going to highlight some of these things that we might see. So again, these might not allow contamination right now, but they could grow and allow contamination in the future. So we would maybe say that's in between and that we'd want to keep monitoring it. Are there any questions about that? Maybe what you should do if you see an in-between, or maybe any other questions on how to determine what an in-between might be? Tom and Bettina, if you have anything to add, please.
Rather support, really, because I think it's better to have a focus on what might be a risk factor rather than omitting the risk factor. So supporting what you've just said.
Thanks, Bettina. Bellis, I see your hand raised.
Yes, good afternoon. Sorry, there's a lot of echo. Okay, my question is, when we do this sanitary inspection, we just take a look or test that one? Because I remember in one of our sections we had before, I asked if we need to check if the apron is well or not compacted. So I use it to knot it, use it one tool or something like that, because that one will prevent the cracks in the future. So that's, I would like to better understand when I'm going for sanitary inspection, is just take a look or can check in terms of knock it, beat it, and see, no, this one, it's not well compacted. So in the future, definitely I'll have a crack. Thank you.
Thanks, Bellis. Let me make sure I heard your question well. So I know that you've asked previously about checking certain things like the erosion and making sure something is well compacted. And I believe you're asking today if, when we do sanitary inspections, if we just visually look or if we go in and actually check some things like the compaction of the soil. Is that correct? Okay, perfect. So I'm gonna maybe pass this off to Bettina and see if she has an answer for you. My understanding is most of this is visual, but Bettina, would we go in and actually check something like the erosion or the compaction of the soil, and maybe how would we do that?
I would say most is visual, and checking in further detail would, for me, already be a follow-up action. So if you see that there's some damage and you want to look in more detail what needs to be repaired and how, that would, for me, already be follow-up action. But if you can already do that on site while you are there, I think there's no reason to not do it, because traveling to the site and back is usually part of the biggest costs or the biggest resources that are needed for a sanitary inspection. So whatever you can do on site is recommended to be done immediately. But strictly speaking, also in order to make it as easily applicable to everyone, the focus is on the visual inspections and not so much on further activities that may also be, at least in part, challenging to do for those who are not technical staff. But I also see Tom's hand is raised. So, Tom, if you want to add to that.
Yes, thank you. I was just thinking off the top of my head. So yes, I agree. This inspection is a visual inspection, so we can't see what's underground. But just wondering, Billy's, could we look at the records of how it was constructed? Are there design drawings that were used? Are there photos from the construction process that we could look at? So maybe it's thinking about, well, what can we see today, but also what can we see of how it was built, how it was designed? I don't know whether that would be helpful in such a situation.
I think it would be helpful, definitely. You probably wouldn't do that every single time you do a sanitary inspection, but to get a clearer picture at the start, once you get to know that particular site, I think that'd be very helpful.
Bettina, maybe going one step further, can sanitary inspections be used at the design stage to help people think through what's required even before anything's been built? Or is that not quite something that's the purpose of it, I guess?
I think that'd be, if you look at the WHO sanitary inspection forms, that'd be more the technical fact sheet, where you can have a look at how such a service is technically sound to be designed. So what should be there, how should it be done, etc. I think that's more in the technical fact sheet and not so much in the sanitary inspection form, which is looking at risk factors. I mean, of course, you can have a look at that as well and try and avoid the risk factors. For example, if you choose where to site your groundwater abstraction, then if you already have sanitation facilities in the area, then you would try to rather locate it upstream of any sanitation facilities and far enough away. So going through the list would already be helpful in combination with the technical fact sheets, I would say.
Thank you both. That's very helpful. Any other questions about this kind of in between or when we're unsure?
I think in the chat there's rather some comments still on M-Water about possibly having to pay for the application and that data was lost in a previous version of the app.
Let's see. Yes. Okay. Thank you for the clarification. It looks like you can pay for a custom version if your organization wants to scale it. Okay, so maybe there is a level at which you pay for the service, particularly if your whole organization is maybe using it. I did not know that you could do that with a custom version. So maybe at an organization level, that's something you want to look into, but maybe that also sets some limits for how useful it might be for your organization, and you can look into those. Okay, and it looks like there's been some challenges with data loss. I'm wondering if that's potentially trying to fill the forms electronically in the field. I thought there was a way to do that offline, and then load it when you have a good connection. If anybody knows whether that's possible or not, feel free to drop that in the chat as well. But yeah, I'm not familiar with whether it has to be connected to a data service all the time or whether you can do it offline. Okay, so it looks like we can do it offline, which is great. So you should be able to collect the data offline, and then hopefully when you have a better data connection, be able to upload your results, and hopefully they don't get lost. But Beauty, if you had other challenges with data loss, feel free to type those in the chat as well, and then maybe we can look into it offline and see if there's any tips. Maybe Cellular Bay can give us some tips on how it's done, or we can find some resources on the MWater site that might help. Okay, so we'll go through a little bit of review on Unit 2B. So again, we have a few questions that we'll ask to kind of get conversation, but if you have questions, this is your time. So please just raise your hand, type them in the chat. We'd love to discuss what's on your mind and what you're maybe having challenges with. That would be our preference, but while everyone's maybe thinking of their questions or getting them typed out, we'll do this second poll. So for your specific context, which SI implementation challenge is most present? Quite a few votes coming in. A lot of consistent risk factor identification, some human resources, a little bit with budget constraints. Everybody got their answers in. Give you 30 seconds. Okay, so here's what everybody's saying is the challenge that's most present in your context. So there's a lot of difference. Or just everybody's kind of spread out. So no one has a challenge adapting forms. I'm curious, have you tried? And maybe you just haven't tried to adapt the form, or is it necessary? Maybe you don't feel that adapting the form is necessary in your context. But a lot of votes for human resource challenges, and then some for risk factor identification and budget constraints. Um, are there any of these particular challenges that somebody maybe has a question about or would like us to talk through on the call this morning? What would be most helpful for you all who are on the call? Oh, yes, I can repeat the question. If you didn't get a chance to answer, you can answer now. But yes, any questions related to any of these challenges? Um, if you've already answered, you don't need to answer again unless you'd like to. But yes, questions related to these, any of these that you'd like us to talk through this morning? Human resources is still coming out as the biggest challenge, but risk factor identification and budget constraints are close follow-ups. Okay, so NAPTI says that they haven't started an SI program yet, but they think that this factor medication would be. So great. If you don't actually have an SI program yet in your organization, you can answer this with what you think would be the biggest challenge. Thank you for that clarification. So yes, maybe you don't already have one up and running, but what do you think would be if you did start one? So human resources now is a clear winner um, with the new responses. So a lot more votes for human resources. So that's a big challenge, of course. Um, so in the interest of time this morning, I would like for Bettina's going to get to share a little bit about how her context does SI programs, and hopefully that's going to be helpful for everyone to hear. And then if we have specific questions related to that or human resource challenges, we can go through those as well. So I'll stop sharing, and Bettina will let you speak.
Should I just start?
Yes, sorry if that was an abrupt. I know I was just looking at the clock and I want to make sure we have some time to hear.
Not to worry at all. Yeah. Okay. Thanks a lot. Yes. So just to share some experiences how we came about to have our sanitary inspection forms. We have the national legislation for drinking water, which requires water suppliers, including those operating the very small water supplies that only provide drinking water to up to 50 people, to do regular inspections. And we have about 0.5% of our population that's not connected to the central water supply system. So they would typically be served by private wells or those systems only serving up to 50 people. And it is quite hard to reach those people because it is the case that they're typically located in rural areas. They typically don't have water supply as their main task, as their main job. So trying to reach them, we drafted some guidance for these operators. We have a national working group on decentralized and private water supply systems. And there we have some national representatives of the 16 federal states, as well as people from some local health authorities. And together we drafted this guidance for water suppliers that includes the sanitary inspection forms that they can do for their regular inspections. That if they provide drinking water to others as part of a commercial or public activity. They have to do the annual inspections. If they only provide water for their own families, it's recommended that they do these inspections. So the first question was, of the large number of sanitary inspection forms available internationally, which ones to choose. So we selected those for the systems that are typically prevailing in our context, which would mostly be spring sources, dug wells, as well as boreholes. And we adapted those forms to the national context and, of course, translated them into German. We also had some pictorial guidance on what the systems should ideally look like. And this leaflet that includes the sanitary inspection forms works with a color scheme. So each technology has a color assigned to it. So whenever there's information in the booklet, it's easy to follow with the color scheme to get to the information that is relevant for the operator of one particular system. And in order to reach the people and to hopefully also get them to apply the sanitary inspections, we did not only provide this information online. It is available online also in editable Word formats, so they can easily use it, but we also printed large numbers of those in order to reach as many of the operators as ever possible. And of course, it's not like private well owners knock on our door to tell us about their experiences, but what we've heard through other sources, for example, from local health authorities, people found this quite helpful, quite useful, because it's so easily accessible and so easy to use. So that's how we try to reach particularly the operators of small systems and in rural areas, in order to make sure that they not only have a look at their system, but also know what to look for and how to identify risk factors. And in the guidance, we also included some follow-up action recommendations. So not to leave them alone with the information, yes, I have a risk factor here, but also giving them some guidance on what they can do if they've found risk factors, how they can take action. As well as the general recommendation to reach out to their local health authorities and try in cooperation with them to find a solution, to find a good approach. So if there's any questions, feel free to ask straight away or to drop them in the chat. I can also share the link. The guidance is in German only, though. I don't know how helpful that is for people. But yeah, I'm happy to take any questions. Thanks.
Thanks, Bettina. Any questions? Particularly, I know some people said they hadn't started an SI program yet, so maybe you're working into some of these challenges on how to adapt your forms or start using them, or encourage the use maybe with communities or water committees. Any questions for Bettina on how they've done that?
I've seen there is a question in the chat about the percentage of the population served and how many people that are. It is about, 450,000. So the latest data is from 2022, I think, when it was published. So about 450,000 people were not connected to the central water supply. And we do not have a detailed number of the systems because it's not obligatory to report that information to the national level. But we do have this figure, how many people are not connected to central water supply. And so the assumption is then that they are served by these, either by own private wells on their premises or by very small water supplies that only serve up to 50 people. So that could be, to neighboring properties or just very, very small water supplies.
Any other questions? Either for Bettina specifically, or has anyone thought of a question that they have maybe related to what they're going through in Unit 2B or the course as a whole? Okay, well, we have about 10 minutes left. And so, Tom, I'm going to let you queue up the quiz that you've prepared, if you would be willing and ready to do that. Tom has put together some questions for us to go through this morning. Hopefully that will maybe jog some questions. But if at any time, again, you do have a question, please feel free to raise a hand, drop it in the chat. We'd love to help talk through those questions. Alice, I see your hand raised.
Can you hear me?
Yes.
Yes. Okay. In World Vision, we are using what we call M water. Okay. And also there we have what we call quality management system that we are trying, to post everything that we have surveyed, or that we post in M water. And but we have a checklist for different stages or phases of the project. We are talking about the design, we are talking about the construct, all of these. And somehow the questions are being raised in these SCI. We also have them in our checklist. So do we need to adapt those checklists and these SI questions in all one form, so different forms, but trying to combine them, or we need to use them separately? I know that you don't know exactly about our checklist, but what I'm trying to do is we need to follow strictly what are the questions, everything that are in SI, the way that they are now, or we can adapt them according to our context, because now the question is about our current context. Currently, myself, I'm covering 8 countries. We have a different situation, different countries. Okay, so my question is around this one. So, I don't know if you get me clearly. Yes.
I believe so, and you can clarify if I get the question wrong. So it sounds like you're using SI forms in MWater already, but you're asking about potentially adapting those forms. So it sounds like you personally work in 8 different countries. That's a lot of different contexts to use one form in, right? So first off, the way the SI forms are set up in MWater is all the questions for all the inspections will be in one survey when you initially start it. So if that was part of your question, you will need to adapt that specifically just to include the questions for the inspection you need to do. So you'll need to delete sections that don't relate to the technology that you're looking at. So that would be a quick adaptation that you would need to make. Further adaptation, so maybe contextualizing the forms, using different pictures, maybe adjusting the wording of the questions. Those are some of the adaptations we talk about in the course, right? And I believe that those can be very helpful, specifically in contexts where maybe your technology looks different, or where you may be having particular confusion around a risk factor or the way it's phrased. then those kinds of adaptations can be very helpful, assuming that your organization has the capacity and the ability to hopefully make some of those changes. Um, if anyone has something to add on that, or Bellis, if you have a follow-up question, if I didn't get it fully, please let us know. Okay, great. If anybody has follow-up questions on that or how to adapt forms, feel free to share those as well.
Thank you, Billy's. Your question made me think of this question, which you can see on the screen, and thank you, Nabde has already responded in the chat. This is if we've got time, if you want to hang around, we're going to do a bit of a quiz. So if you want to refresh yourselves on what you've been learning, here's a good opportunity. Obviously, as well, we need to make sure you're learning everything that you need to know. So we'll give a bit of a test. But how does this quiz work? Well, there are 4 categories, and each question gets a different number of points. Now, I think in this course we have 5 groups, is that correct? Group 1, Group 2, Group 3, Group 4, and World Vision. Yeah. So you may recognize, if you're in Group 1 or 2, so Antoinette, Jamal, Linda, Beauty, Eddie, you may be familiar with me. We've been discussing in the forum. Other people on the call are in either Group 3 and 4, and maybe more familiar with Jessica, and the other group with World Vision. So we're going to do this in groups. So what we're going to do is invite to put your hand up if you want to answer a question. And if you can answer correctly as a group, then you get the points for your group. And so each week we'll do a little bit of the quiz and see which group comes up top in the leaderboard. So if you'd like to play, raise your hand, first person, you represent your group, and you get to choose the topic. There's 4 topics, and you get to choose how many points you're going to go for. So the larger the number of points, the harder the question. So the easy questions are this 100, 200, starts getting a bit tricky at 300, 400, 500, very, very tricky. So hands up in the chat or shout out, type in the chat. Who wants to go first? Who wants to have a go at winning some points for their... Okay, Napte, very good. Napte, which group do you represent? You can unmute and speak or type in the chat depending on what's possible. Group 2. Oh, Group 2. Oh, fantastic. Napte, what's your full name? Napte. Oh, Napoleon. Oh, hi, Napoleon. Sorry, I saw Napte. I didn't realize. Okay, so Beauty Eddie, you can help Napoleon. If Napoleon, you don't get it right, we can defer to another group. So Napoleon, which subject do you want to choose? The subjects are all linked to the challenges we face when doing sanitary inspection programs. Napoleon, which subject would you like? Package, adaptation. I think we're all quite happy with that, I think, possibly. Risk identification, human resources, or budget constraints. Now, if you want to play hard, choose the one that you think is the most challenging for you, or if you want to guarantee the points, choose the one you're most confident with. Napoleon, which section would you like? You can unmute and speak. You can type in the chat, whatever's easiest for you. Which topic would you like out of those 4 topics? Package adaptation, risk identification. Risk identification, great. So what number points do you want to go for? For group 2, Napoleon, how many points do you want to go for? 100, okay, going for let's start easy. So you can see the question on the screen. Napoleon, can you give 2 reasons why staff may interpret the same situation differently during a sanitary inspection? Can you give at least 2 reasons why staff may interpret the same situation differently during a sanitary inspection? So Bellis is also on the game, but I think Bellis, you're in another group. So for this question, Napoleon, if you're not sure, Beauty, Eddie, you're also on the call. You can help out your teammate. You can type in the chat. You can speak. Napoleon, what do you think? You can ask Eddie and Beauty what they think. I know Bellis is really keen to respond to this question, which is great. So we'll go to you after Napoleon. We're going to go one person at a time, one question at a time. Okay, Eddie, are you there? You're in Burundi, in Bujumbura. Can you help Napoleon, who I think is calling in from Ghana. Can you help? Two reasons. If Eddie doesn't respond soon, or if Beauty doesn't respond soon, I'm going to pass it over to Belize for the points. Beauty, you've been chatting away. Eddie, going to give you some time, but if not, it's gonna switch to another group, and they're going to get the chance to get the points. Napoleon, what do you think? Looks like Eddie is leaving it to you in your judgment. Two reasons why staff may interpret the same situation differently during a sanitary inspection. Can anybody help? Can anybody help? Can anybody help? Eddie? No. Aha, great. Lack of proper understanding of risk factors. Lack of proper understanding of risk factors. That's one. Another one. One more for the 100 points, and we're going to keep scores. This is group one. At the moment, I'm giving you 50 points. Can you get the full 100? Or can another team get? Okay. If you think you know something else, type it in the chat and your group will get 50 points. Next person to type something or say something gets the next 50 points. I'm going to give you a countdown. 5, 4. Now, for the other 50 points. Standardization. Let's have a look. Here are the results. Well, here are the answers. And Bettina, Jessica, you can tell me if I've got this right or not. So cellular-based standardization, the word is relevant, but I think I want to see more to get points. So I'm giving group one 50 points for lack of understanding of the risk factors, so varying interpretation of the SI questions. We've also got personal judgment perception. For those who joined at the start, I had a visit from someone who's a professional cleaner to inspect how clean our house is. And we had very different interpretations, differences in training or experiences. Some people may be very familiar. They may have very little experience. That all influence how different people can interpret the same situation differently. Okay, Belize, you wanted to get involved, so we'll go back to the start. So risk identification, we've done the 100. Um, Belis, would you like to choose a higher point question for your team? Belis, what group are you in? Belis, what group are you in?
I think I didn't get well the question. That's why I just asked be part of this resident teachers. But now the way that you're speaking, I think that I'm coming out of this competition.
Oh, you're not going to take part? Oh, you sure? You sure? For your team, which group are you in, Belis?
I think if I'm not wrong, I'm in one.
Oh, right.
Well,
What's your full
well,
name?
Belis Antonio Matabire.
Mm,
Belis Matabire, yes.
So I don't recognize your name. Would anyone else like to have a go at a question? We've got loads of questions to choose from. Would anyone else like to have a go? Maybe Sally or Beer, you mentioned in the chat. Who would like to have a go with a question? If not, I'm going to choose. Oh, sure, no worries, Antoinette. So, group one, you're down a person. If you can stay on the call and you want to do some quizzing, feel free. Aha, Mita, I think you're in Indonesia, is that correct? Wahana Vizi, can see behind you. Great, Mita. What category would you like?
I will try human resources.
Human resources, very good. What group are you representing?
Uh,
Are you in World Vision group?
yes.
Oh, fantastic. So if there's anybody else from World Vision on the call, you can help Mita. How many points are you going to go for? You're going to play it safe. You're going to go for the big money points.
Uh, It's a good question. I would try 200.
200. Okay, so stepping it up a level, but still maybe a bit cautious. Okay, human resources. Give at least two risks of having just one person dedicated to doing sanitary inspections. So imagine you've just got one person who you've trained, who's responsible for doing sanitary inspections. What could go wrong? What risk are you running of having just one person? So if you're with World Vision, and let Mita know. If not Mita, if you think you're going to know the answer, go for it, and we'll see.
Yeah, I think one would be overloaded. So the data maybe not collected well. So that the
Great.
collection is not going well. And then the second would be not carefully doing the observation or identification.
Tell
Yeah,
me a bit
that's
more.
my
So
question.
how? No, no, it's good. It's good. Mita, tell me a bit more. What do you mean by being able to do the observation if you just have one person? What is it that might be a risk or an issue? Just explain a
Yeah,
bit more.
the first is the data, the quality of the data collected is compromised because you have to. I'm thinking the person should finish a lot of SI with different systems, the different locations. So rely on one person is compromising with the quality of the data, and then less. I think the person will be doing rush in observing or doing identification.
So great. Thank you, Mita. So you're saying that with just one person, they might be overwhelmed by how many sites they have to visit. They might be in a rush, and you might then have, the quality of the data you might put into question. And we were talking about this a bit earlier about standardization of interpretations. And if it's just one person, it's just whatever they think. That's what is the answer. I had some other points. I think I would add these, what you've shared. I'm going to give you the 200 points. I've added these. Oh, Napte, Napoleon is looking to get some points for Group One. Well done. Let's see. You risk not covering entire sites since one person won't be enough. Even more, the person cannot conduct the inspection if they cannot drive or ride. Right, geographical scope, troubleshoot. Maybe that's that issue you were saying, Mita, about the quality. You've got no one to kind of talk to if you're just doing it on your own. Um, I've added on a couple of other ones that you can see on the screen. I'm gonna give World Vision 200 points. I might be a bit Jessica's asking if Napoleon is Group Two. I think. Oh, actually, yeah. Are you Group Two? Yes, you are Group Two, not Group One. Um, so Napoleon, I'm also going to give you 50 points for your uh, comment on not being able to get to enough sites. So Group Two at 100, World Vision 200. If you want to play, raise your hand. If you need to go, don't worry, please go. If you've got any questions that you were hoping to ask and you haven't had the chance, please ask them. So raise your hand, type in the chat if you want to play the quiz, or if you've got a question. If not, you're free to leave. Are you happy with your 200 points, Mita? You think that's fair? Fair judgment? Bettina, are these answers fair that I've got on the screen, do you think?
Yes, I think so. I think the sheer number of sanitary inspections that need to be done is a very limiting factor for sure. And if you do one task and you're the only one doing it, then you don't have the exchange of different views, etc. So, for example, we discussed earlier the in-between cases that one person may have one view on how to assess those and won't be able to exchange with others and take on different views. And I think this is just the overarching issue that you generally have. And I think that you very nicely phrase the options that you have here for answers.
Good, good. Exactly. Being able to troubleshoot, talk to someone else, very important. Thank you, Bettina. Euclides, do you want to take part in the quiz? Do you want to ask a question, Euclides? I can see you've commented in the chat. Do you want to take part in the quiz? Okay, Jessica, groups 3 and 4, I feel are underrepresented. They're your groups. So, in the absence of someone volunteering, I'm going to ask you to see if you can get some points for your group. And you can also you can call on the people that are in your groups 3 and 4. So this is for anyone in group 3 and 4. Jessica, would you like to take a subject and a question?
Hmm.
Putting you on the spot here.
You
This is for
are.
group three
That's
and four.
okay. That's okay. I'm trying to think of which
Yeah.
category will be helpful for everybody.
We haven't done budget restraints yet,
We haven't yet.
just for
Okay,
variety.
let's just go for
Um,
300. Let's up
300.
it a little bit. Let's try.
Okay. So if you're in groups 3 or 4, you can help Jessica. He's there to get you points. And Bettina, I'm going to let you judge the answer.
Oh
Um,
man,
okay,
go.
300 points. Surveillance agencies only conducting sanitary inspections periodically, that is, every few years. What is the purpose of their visit? Some of the grammar might not be spot on here, Jessica. Please apologies for that. Um, so surveillance agencies are conducting sanitary inspections every few years. Why? What is the purpose of their visits? They're the surveillance agency.
Mhm.
Why are they doing that? So
Okay, let's
if you're
see.
in group 3 and 4,
Groups three
and
and four.
you want to
Feel
help
free.
Jessica, is Euclides in group 3 or 4? You know?
Mm.
You might also be wanting to move on to another call. If you're on the call, please feel free. But Jessica, for 3 and 4, and then afterwards, Jessica, you can decide which team to give the points to.
Maybe
Or
we'll split
split, or you
them.
can split. Oh, you're gonna split them. Okay,
They're
so
going to
let's
get
split.
split unless somebody speaks up. If somebody
Okay,
speaks up, you can have all the
okay,
points for your team.
great.
Okay, so what's the point of their visit for the surveillance agency? I'm just trying to think of the word
Hmm. Oh,
confirmation. Ooh,
Napoleon's going in from group 2.
Napoleon's going in, he's stealing.
Oh, confirmation,
Oh
Napoleon.
man,
Jessica did hesitate.
I did.
Napoleon, what are you saying? Do you want to explain more as a confirmation of what? I want a full answer for the points. But Jessica, if you think you know, jump in. It's a race now between you and Napoleon. I'm slightly biased to Napoleon because he's group 2.
Well, the word I was going to go for is verification, but it's very similar
Uh-huh.
for confirmation. So I
So,
don't want to.
oh,
Oh,
Amita as well jumping in. Very good. Validation and
and QA,
QA, QC.
QAC.
What does that stand for, Amita? QA, QC?
Quality assurance or quality control.
Thank you. Quality assurance, quality control. Um, what's the difference between quality assurance and quality control, Mita? This is like totally off the points.
Yeah, quality assurance is like checking whether they are following the procedure, something like that. Following the SI correctly or following the technical the definition. And then QC is more like checking whether they are doing they are how do you say the checklist something like that.
Thank you, Mita. So yeah, so like quality assurance, that's what you can do before you start doing something, isn't it? So you're checking the forms are correct, you're checking people are trained, and then quality control is kind of looking at, well, how good a job are they doing? Are they doing the forms well? Are they using what they've learned in their training? Would you say the surveillance agencies, are they doing quality assurance or quality control? So they're verifying, they're confirming, validating. Is it quality assurance or is it quality control? Aha, thank you, Napoleon. Yes, quality assurance is making sure everything goes as planned, and then quality control is mitigating. So looking at what might have gone wrong, to take words from your mouth. So is this quality control, quality assurance?
I think is quality control because from that they probably will come up with some corrective action. Yeah, maybe. Yeah.
Great. So we're looking at inspections are done every few years, and the purpose of the visit is to verify, like the check the quality afterwards. So is what people are doing, is it working? Is it effective? Is that what we're saying? So I'm going to put the answer here. Now, do you think it's both? Bettina, what do you think to this answer? Jessica, what do you think to this answer? So we're verifying whether the actions that have been put in place at these sites, whether they are being effective. Is that right? Hang on, let me read this myself. To verify whether the risk management practices being used are effective. Would anyone like to unpack that for me? Yes, Bettina.
I would say the answer is correct, but maybe we could also add a few aspects, because
Please do.
it may not only be the question if they are effective, but if they are implemented at all. So it's kind of conducting surveillance on what the operators are doing and if they are doing it at all. So I think this is one aspect. But I think a very important additional aspect is also to get in touch with the operators, to discuss with them any open questions they might have, etc. So it's in the surveillance function, I would say the answer is correct, but it may be useful to not only put the strict surveillance goggles on, but to also be a cooperative partner to the operators and provide them with additional guidance, etc.
Thank you, Bettina. I can see as well, Napoleon, Belis, thank you. You've commented in the chat too. So, Bettina, you're saying that so sanitary inspections have been done by the operators. Maybe they've done it for months and months, years and years, and they've identified risks, and then they should be doing something to mitigate those risks. So they can see there's a drainage channel which has eroded away and there's runoff coming into the spring. They fix the drainage channel. That's part of their risk management practice. So the surveillance agencies are coming only every few years to see if, right, this is what they said they were going to do. Did they do it? How well are they doing it? And are those practices that they've chosen, are they the right ones? They might do some, then this is where we're going to be looking at water quality testing next week of, right, has there been contamination? Is it because the drainage channels weren't cleared properly? We start putting the pieces together of the puzzle of what's going on. So it's that checking, have they been doing the right thing? And as Belize mentioned, yes, so quality assurance is about preventing things from going wrong, and quality control is to find out what might actually be going wrong. I hope that makes it a bit clearer. I'm very lost now to who's getting points for this question, because it started off with Jessica for group 3 and 4. I think Napoleon's jumped in, World Vision have jumped in. Belize, I can't remember what group you're in. So Napoleon, you're also saying that having that knowledge that someone's going to check your work, yes, very good. So having that knowledge that someone's going to check your work afterwards means that maybe that'll nudge you towards actually doing what you said you would do. So if you're that inspector, you've gone to the site and you know in the next few years someone's going to check my work, I better do a good job. So it adds in that quality control, that check after the work's been done. So why have I put this question under budget constraints? So maybe this is the last question. We're kind of going way over time here, but can anyone tell me why have I included this question under budget constraints? And that will give me a moment to think about how I score people for this as well. There's 300 points available. Why have I put this under budget constraints? And we can make this the last question, and then perhaps we can close the call. Mita, why have I put this under budget constraints? I'm asking you because you've got your camera on.
Yeah, I think I have two answers. Number one is when you make a plan, you should budget for this period. Like not maybe not only 1 year annually, but maybe once in 2 years to put budget for QC or for the visit from the surveillance agencies. Maybe for refreshing training and something to improve the quality the data collected or the SI inspection. And the second maybe is because the budget is always an issue. They don't have to come every year or every 6 months. So 2 years or every 3 years maybe is enough. So that's my answer. Thank you.
Thank you, Mita. That's right. So, as we said, as Bedina said, there's so many water points, infrastructure to inspect. It can be overwhelming. We might not be able to visit them all. Scheduling these quality control inspections every few years means we're not spending as much money, and it's our way of doing that check for all the water points over a certain time period. So we're using the resources we have to make sure there's some follow-up checking going on, and that might reveal that these water points, particular water points, we need to put more resources into because they're consistently giving risk factors that people aren't identifying, or maybe we've got an issue with accessing the sites or issue with the staff. That's right, because as Napoleon says, this is capital intensive. My other question was, well, who is paying for this surveillance? Do they have their own funds, or like Mita was saying, do you have to include that in your budget to give them a per diem perhaps for their sites or help them with transport? It might not be monetary, or might be resources such as a vehicle, a driver, somebody mentioned that at the start. All that told, Bettina, did you want to add anything there, or Jessica?
I think you also have different setups in different settings. Sometimes the operators would need to also carry some of the resources for the surveillance activities. Sometimes it's only the surveillance agency, but in any case, resources are needed. So it's certainly a consideration to have. And yeah, I think it's a fine line of visiting every single system often enough, and trying to balance, maybe also focusing on more frequent visits to the sites where risks have been identified in the past, to make sure, because they typically need more support, that they get more support, and that there's also more checking whether these risk factors have been followed up, which could mean that the sites where no risk factors have been identified and that work as they should might be visited at a lesser frequency, in order to really not just focus on the single risk factors within one water supply system, but also for the number of systems in the area.
Thank you, Bettina. That's right. It helps us decide where to send people, where to use our resources. So if we see consistently there are some sites where there are no problems, perhaps we can say, well, maybe we visit those sites less regularly because we've got confidence that the risk management practices that are being used are effective, they're working well, we're not seeing contamination risks, people getting sick. And that's the overall goal of this piece of work. And next week, we'll be looking at water quality. So we're going to call, I'll bring this to a close, but if you've got any other questions, please do respond in the chat. So I've decided to give some points to different groups after this discussion. I've given Mita, I've given your World Vision team another 100 points. Napoleon, I've given your team another 50 points. Group 4, thanks to Jessica, you've got 50 points, and 50 points for group 3. And then I think we had somebody else from group 3 join in. I've given you 50 points. So all told, with very careful counting, these are the current scores after round 1. Join us next week for round 2. We might have a whole new quiz. You never know. But if you've got any questions, please do post them in the chat, raise your hand. If not, thank you so much for joining us. Jessica, if you're on the call still, if there's anything you'd like to add, please do. But I know we're moving into conducting water quality testing. Week 4 starts on Monday. So you should be looking at Unit 3, the start of Unit 3. So I encourage you to catch up if you need to for Unit 2. Do make the most of the forum, post, respond, tag, like use the permalink if you want to copy someone's post and share it with somebody else. Yes, Jessica. Sorry, you didn't get more points for your groups. But group
That's
one
okay.
didn't get any points, and that's one of my groups, so I feel a bit disappointed
I'm happy to see so many others jump in on the answers.
there.
No problems from me. I don't have anything else to add this morning, so appreciate everybody being here and participating in the call. Thanks, Tom. The quiz was fun.
Yeah, I feel it lost. I think I lost the way slightly with my quiz, but and the scoring, I don't know how the scoring is working. It's. I'm glad no, there should be some quality control, I think, for awarding points. Thank you so much for joining. Look forward to seeing discussions in the forum, and for those who can make the live session. For those who are watching back, maybe a bit too late now, but you can pause before the answer to the questions and have a go, and then let us know if you've got points for your team. But I should have said that earlier. Um, all right. Have a great day, evening, wherever you are.
Thanks, everyone.
Thanks, everyone.